So this is Iris Martinez, an interviewer for the Iowa State University Special Collections and University Archives Voices of a Pandemic Oral History Project. Today is Thursday, July 8th, 2021. I am interviewing Sonia Reyes from Ames, Iowa, while she is in Des Moines, Iowa. Please know, Sonia, that this interview will be placed in the Iowa State University Library and shared with Voces Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. Okay, because we are not conducting this interview in person, I need to record your consenting to a few questions. So I'll ask you a series of 5 questions. Please say yes, I agree, or no, I do not agree after each one. There are 2 questions we need to make sure you agree to before we go on. Voices wishes to archive your interview along with any other photographs and other documentation at the Parks Library at Iowa State University. We will retain copyright of the interview and any other materials you donate to Voices. So the first question is, do you give Voices consent to archive your interview and your materials at the Parks Library?
Yes.
Okay. Second question, do you grant Voices copyright over the interview and any materials you provide?
Yes.
Okay. And third question, do you agree to allow us to post this interview on the internet where it may be viewed by people around the world?
Yes.
Okay. We have many questions in a pre-interview form that we have already filled out. We use that information from the pre-interview form to help in research. The entire form is kept in a secure Voices server. Before we send it to the Parks Library, we would have stripped out any contact information for yourself or family members, so that will not be a part of your public file. Your public file will only be accessible at the Parks Library. So the fourth question is, do you wish for us to share the rest of your interview in your public file available to researchers at the Parks Library?
Yes.
Okay, and the last question, on occasion, Voices receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone number or email with those journalists?
Yes.
Okay, awesome. So we're just going to jump right into it. Again, the goal of this is to just get a broad narrative on what the Latino experience was during the COVID pandemic and continuing. So could you tell me a little bit about your COVID experience?
Yes, definitely. In the beginning of July of 2020, I started having COVID symptoms. I was really tired and I started to feel just worn out. And I ended up on July 9th, I ended up fainting while in the shower. And I woke up and I went to the ER and they sent me home. They told me to because they did a COVID test, and then they sent me home. A couple of days later, I fainted again in my bedroom, and my daughter found me. And then I couldn't walk. I was very disoriented. So we ended up having to call an ambulance so they could help me get to either take me to the hospital or to my car. So they ended up taking me just in a wheelchair to my car, and then my daughter drove me to avoid the charge of the ambulance, which I was really grateful for, that I was given that choice by the paramedics.
Yes.
And once I arrived to the hospital, I ended up being there for a little bit over a week. And they did 4 COVID tests while I was in the hospital, and they all came back negative. So the doctors proceeded to run many, many different tests. They checked my heart, they checked everything. They had a CT scan and many other procedures because they were trying to roll them out since the COVID test started, kept coming back negative. In the meantime, I had a fever of between 103 and 104 almost the whole time that I was in the hospital. My pulse was very low, so they gave me oxygen. So I was on oxygen for about 3 days. And eventually they made a consult with infectious disease doctor who ordered a stool and saliva test, and those finally showed that I was positive for COVID. And then they stopped all the other tests that they were running, and they just they focused on making me feel comfortable since there wasn't really a cure for COVID.
Yeah.
And so I just stayed in the hospital until my fever finally stayed down, until I was able to get up on my own, because every time I sat up or stood up, I would faint because
Jeez.
my blood pressure would drop. And so then I came home. Ended up going back to the hospital 2 or 3 other times because I kept fainting. And but they told me there was really nothing they could do. I was very dehydrated.
Mm.
So I was lucky that I have a very flexible schedule at work, and I have a boss that was able to provide me with, the flexibility of work at odd hours whenever I felt better.
Mm-hmm.
So that's what I did. So I ended up for about a month or so just being able to be sitting or laying down, because if I would get up, I would faint. And luckily, my both of my children were home from college, so they helped to take care of me. And we were confined in a two-bedroom apartment downtown for the whole summer, but it worked out very well that they were home, so they could help me. I had friends and family who um, brought us food and brought us, just basic necessity things, toilet paper, since that was
Mm-hmm.
it was not, you could not find it in the stores.
Yeah.
And so eventually it took me about 4 months to kind of get my back to my bearings, and start to feel better. The unfortunate thing is that I continue to have symptoms. I continue to faint to this day. It comes and goes. And I actually now have a appointment actually tomorrow at the post-COVID clinic in Iowa City, because apparently there's a lot of people who have these post-COVID symptoms. And mine is my blood pressure keeps dropping. And when it drops, then I faint.
That's crazy. That's the first one I've heard of that was so like 4 months is a long time to recover fully. Did your children happen to grab contract COVID as well?
My daughter did. She got it first, and then I got it. But
Okay.
my son didn't get it that we know of. I mean, with I learned in the hospital, the doctors there told me that only 60% of people who actually have COVID test positive. I mean, and so the other 40 some percent continue to test negative even though they have it.
Oh wow. So
So that's a very scary fact.
that's a big number too.
Yes.
That's a crazy experience. Okay, so how did you first learn about COVID-19?
Well, just from the news, and then right away we were told to start working from home.
Okay.
And just from, callers, people, through my work, people started calling and asking for resources. And so that's kind of how I got immersed in the world.
Yeah. So what was your first initial reaction to the news? Or maybe your delayed reaction?
You know, it's very interesting because I grew up in El Salvador, where there's all these different diseases that so for me, I don't think I was as alarmed as other people who are not used to living with that type of fear, or that type of those type of things, and having to take care of yourself, and like going the extra mile, and different things.
Yeah.
So for me, it was just, well, just another thing to take care of until I got sick. Things changed dramatically, of course, when I got sick, because I'm a single mom and I'm the sole provider. And it was really scary to think that I was so sick, and I had my children that I'm responsible for.
Of course, yeah. So is that when you realized that it was serious, or at what point did you think it was serious? Maybe before you got sick, or was it when you got
Oh
sick?
no, yeah, I know. I found it very serious from the very beginning, from reading what was happening and some of the things that were coming out,
Hmm.
especially the fact that people here in Iowa were not taken seriously. They were not wearing masks. They were not following the directions of the CDC.
Yep. So, what kind of daily impacts did COVID have on you and your children?
What was that? I'm sorry.
What kind of daily impacts did COVID-19 have on you, like when it first started?
Well, for me, one of the main ones is I moved to working from home. I moved to having to pay more for my internet because the three of us were working from home, and so that so it was a financial strain. Also, bringing the kids home early. I mean, of course, having three people eating at home is a lot more expensive, and also with not being able to or not feeling safe to go to the grocery store, we ended up having to order our groceries, and of course that adds on, delivery fees and all of that stuff.
Mm.
Also with our the food that we eat, for my culture, some of the stores were not available for delivery, so it was it, our life was out there for sure. My daughter was studying in the Dominican Republic at the time, so her term got cut short, so she came home early, and just a lot of unexpected expenses,
Yep.
but also, the fear and the anxiety and our mental health, took a dive.
Exactly. So, do you think you could give us some insight on how your family from El Salvador, or maybe how it's like over there for the daily impacts during the COVID-19?
Yeah, so in El Salvador, from what I hear from my family, they were things put in place right away from the very beginning. They were not allowing people from the U.S. or any other countries to come in. So it seemed like they took it, uh, like they were very proactive
Hmm.
in the very, very beginning. And but there was a lot of people that got sick. I know a lot of people that passed away due to the pandemic. I have two uncles that passed away
Oh, wow.
due to COVID in El Salvador. And I have, had my grandparents in California who were also struggling with health issues, and this made it worse. So we ended up bringing them to Iowa from San Jose, California, in the middle of the pandemic.
Wow.
And my grandmother ended up passing away here in Iowa just a couple of weeks after we brought her. But so yeah, we have a lot of family members and just people that we know in Mexico and in El Salvador that passed away.
Wow, I'm sorry to hear that. Um, so how do you think going out into the world during COVID-19 was different from pre-COVID?
It was scary. I feel like we didn't really leave our apartment for, I don't know, maybe 4 or 5 months.
Wow.
We were just there. Well, first, I couldn't even walk from the couch to the bathroom without, being afraid or almost fainting. So we were really just at home most of the time because of my health, but also for safety.
Exactly. That makes sense. So, what do you think it's like going out into the world now? Now that the restrictions are being lifted, vaccine is out.
For me specifically, it's very scary. It's very scary because like I said, that those percentages that I was given at the hospital by the doctors about all the people that actually have COVID and but test negative,
Hmm.
it's very scary for me because then that means that I don't know, no one knows really who all out there has COVID or not, whether asymptomatic or not, or who has been vaccinated. There's people who refuse to wear their masks. There's people still to this day do not believe that COVID was real or that is real, and
Yeah.
including family members and friends that I have.
Yeah.
They think it's something else. And I actually ended up making a video from the hospital, uh, for the Latino community, just sharing my experience because when I was there, try to encourage people to wear their masks and to take care of themselves. So now it's very scary. For me, it's very, very scary because I'm still having lingering issues from COVID. So the last thing I want is to get it again
Yeah.
and, go through all of that because yeah, that was one was extremely expensive and like I said, it took a toll on my and my children's mental health.
Of course. So how did you feel about wearing masks, or how do you feel about it now, and now that it's been lifted, the restrictions in Iowa?
I still wear it.
Mm.
I still wear it. I've started to go to some places. I attempted to go to the farmers market, but there was way too many people without masks, and even though it's outside, to me it's very scary.
Yeah.
Because I got to experience firsthand, what can happen. We are back at work 3 days a week in person,
Mm.
and that is extremely scary as well because we are in a state building. There's no ventilation. So all the air and everything stays in there, and people are not wearing their masks anymore. So I wear mine, just for my own safety and for the safety of others because I might be a carrier as well.
Yeah.
So I continue to wear mine. It's hard. It's really hard during the summer when it's so hot out,
Yeah.
but I think it's necessary for me at least.
So was it easy for you to accustom to that mask mandate when it first came out?
Yes, because I believe in science. I believe what scientists were telling us. There's other countries where, they wear masks already for their own protection because of pollution or so I didn't think it was out of the ordinary. I didn't feel like it was a violation of my human rights at all. I feel like it was for my own protection. Um, so it wasn't for me, it wasn't hard.
Yeah. So education-wise, how did COVID-19 change the way you or your children or your community received education?
It was a challenge because I am in school, and we moved from in person to fully online. My son struggled a lot. He's in the engineering school where he's going to college, and just having to do everything online, even like they can't do labs, they can't do things like that. And for me, I'm a very visual learner, so it's really hard. And as an adult learner, also, I believe it's harder to just do things on your own online. At least it is for me. And then being sick on top of that, I had to drop some classes in the middle of COVID. I think I kept one, but it was really hard to keep up with the work just because I didn't feel well.
Hmm.
So that put me back about a semester from graduation. And right now we're still mainly doing classes online,
So
which is a challenge. What was that? I'm sorry.
are you guys planning to switch back to in person this fall, or whenever the next semester is?
Some of the classes will be in person.
Okay. Yeah, I know online school is pretty tough, even from I find it really tough.
Yeah. I
Um,
really like when the professors still give you the lecture,
yeah.
even if it's through Zoom, but when they just tell you to read your textbook, that's I don't retain information that way.
Yeah, I understand that. So you answered some of that question. So were there any resources or tools that you needed or your children needed in school that you guys weren't accessible to, that you guys couldn't access?
I think one of the main things was the internet access because everywhere it was so everyone was working from home, studying from home, so it was very slow at times, and so that was one of the main concerns. Even when I changed my plan to, to have more data, it was still we still when continued to go over. Thankfully, MediaCom waived any of those fees for that year. So I was very, very, very grateful that that happened. But I think mainly that, and it would have been nice, I think, if the schools, not just my school that I'm attending, but my children's school, would have provided more mental health support or more resources or more information about signs of depression, anxiety. Thankfully, I have worked in that field. So, we're able to talk about that and recognize those. But I know that other families haven't. And I know that some of the colleges did have some online sessions, but they were in groups, and it's really hard to open up if you're in a group
Yeah,
with people that you don't know.
I agree. So that jumping into my next question. Did the schools help your community during COVID-19? Like, did it distribute food? Did they provide student accommodations, like technology wise?
Not that I know of.
Okay.
Not that it was, yeah, that I didn't identify a need. I was able to apply and get the funds from school. So I think they from the CARES Act.
Okay. Um, so moving on to some healthcare. Obviously, you've been through a lot of healthcare in your COVID experience. You had to deal with like the front line and everything. What kind of concerns or questions about healthcare have emerged as a result of your COVID experience?
What I've noticed is that pe people are not communicating within the health system. Like my primary doctor has absolutely no idea how to deal with me and my symptoms that I'm still currently have. Every time I faint, I call and they're like, sorry, there's nothing we can do. And I keep asking, what are going to be the long-term effects of my blood pressure to continue to drop? Am I going to have, it's going to affect my brain? It's because I still have the brain fog that from COVID that hasn't gone away.
Yeah.
So what I've noticed in my primary healthcare provider has absolutely no idea. And she didn't know that there was a post-COVID clinic in Iowa City. And so I feel like they're not communicating. They're not providing the support's not being provided to the providers.
Mm.
Just like I had to find out through people that I knew on Facebook, and so I feel like that's a huge. I mean, it's a disservice to the community that those tools are not being provided to the primary healthcare providers. And also I would say just the lack of information that is out there. There's not a lot of information now about the post-COVID effects. There's so many people that are now that that I've identified that I have all of these issues that have issues, but they had to find them on their own. So I think about all the people that don't have access to the internet, that they don't have smartphones, that live in rural areas, or even people who don't speak the language, and they go and find information from other states where there's more people that speak their own languages. So I feel like there's a lack of information out there.
Yes, for sure. Especially for the people that don't speak English as their first language. So how is it changing the way you're doing or getting healthcare? Are you doing more of your own
It
research? What's going on?
I've always had, just because I grew up in El Salvador, where when you go to the doctor, the goal is to cure what you have and not to just give you medicine to treat what you have. So, which is what the practice is here. It's all about the the people who are making medicine and making them rich.
Yep.
And so whenever I go to the doctor, I always ask, what, okay, yeah, you're gonna give me something for my fever, but where's the infection? For example, where is it and what can I do to prevent it? And what are you going to do so that, or what is my plan? So I feel like now I go with specific
Yes.
questions, and I don't just take one doctor's opinion. I go to, I ask for different opinions because they're human beings and they only know what they know.
I agree.
So I would say maybe less trust
Less stress. Yep.
now.
I could see that. So you've talked a little bit about like the mental health impacts. What did you have? Obviously you had, but can you tell me a little bit about the mental health impacts or challenges that you and your family went through or are still going through?
Yeah, definitely. I was extremely depressed because I didn't feel well. I've always had anxiety, but my anxiety was even worse during that period, and so I had to start taking antidepressants and anxiety medicine. And thankfully, telehealth was available, and I was able to meet with my mental health therapist once a week, and more if I needed to at times. But like I said, I have health insurance and I'm able to pay for it. And also, I speak English, so it was a lot easier to find a provider.
Yeah.
Um, but when it came to my mom and my stepdad had it, they had no access to those services because there's not really that many mental health providers that speak Spanish
Yeah.
or that would take certain insurances. So there's a lot of barriers for other people. For me, I know that I'm privileged to be able to find someone and communicate with them. Um, so yeah, so for me, I had to start taking antidepressants, anxiety medicine. Even now, I'm still taking that because I live with fear. I don't know when I'm going to faint, and so that takes a toll on of how I live my life and where I go, who I go with,
Of course.
and I would have a backup plan. And thankfully, I'm able to continue with therapy, and both of my children also have access to mental health services.
That's great. So, how do you feel about the vaccine? Do you have any problems registering, getting the first one?
I'm vaccinated now, but in the beginning it was really hard. It's just such a challenging way to get vaccinated from the beginning.
Yeah.
I was lucky that I worked from my computer, so I was able to, whenever I got a link to sign up to go get the vaccine, I was able to sit there for 45 minutes, an hour and a half, and continue to refresh the page until I was able to get through. But not everyone has the privilege that I had. And still, it took me a long time to be able to finally get in somewhere.
Oh,
I
yes.
know a lot of people that had to drive to other cities to get their vaccination,
Yeah.
but I am fully vaccinated now, thank goodness.
That's great. So how, if at all, have the organizations that you're a part of provided resources regarding COVID-19?
One of the reasons why I'm involved in the organizations I'm with is because were very proactive, and they were, disseminating information. They were doing grassroots work to be able to assist the different communities in the state.
Yeah.
And so I'm very proud of, the ACLU of Iowa and the Indian Faith Alliance that they were able to provide all of that information. And there were a lot of efforts here in the city of Des Moines, but there were so many things that were not done. There were our marginalized communities were overlooked. They were not being provided the services, the funding, our Latino and immigrant and refugee serving organizations did not get really funding. They were funding white organizations, which is why I made the decision to apply to be on the commission of the Des Moines Civil and Human Rights to help create change and make things more accessible if this from moving forward.
Of course. That's great. I'm glad there was many resources that like were able to show their light in this time because I've heard a lot of good resources that have came out of this.
Yeah, I actually started the as a volunteer with a couple of other not organizations, other Latino leaders from around the state. We started the Línea de Ayuda, the Iowa Spanish helpline,
Okay.
and we just met. There was no information being provided in other languages.
Yeah.
The only number that was given for information was 211, and 211 did not have um, uh, the capability of helping one non-English speakers or to provide culture-specific information.
Yeah.
So we started we started with a Google phone number, and then we as volunteers started taking calls. I couldn't stand up. I was uh, bed bound, so I was able to, answer calls on the weekends and the evenings after work or before work. And so now it is established line, and then there's now organizations that are supporting it.
That's
So
amazing.
that's something that came out of that. That's great for the community.
Yeah, that's amazing for the community. So let's move into some politics. I know you're working for the state. You must have like the inside of somewhat the inside of it, but how do you believe the politics affected how COVID had been handled or is being handled?
I can't I can't speak on my capacity through work. This is, on my personal time, not through work time. So not as a state employee, I can tell you just from my own personal experience, on my personal opinion, not my professional opinion,
Okay.
that COVID was, in my opinion, was used as a tool to continue to discriminate and to continue to oppress the people that were already at the bottom, because those were the people who did not get the help. They did not get the information. They did not get the health care. All of those essential workers, a lot of them are new immigrants or people that have come here with refugee status, who were dying, who were losing their jobs, that are now losing their housing, they've lost, some of them have lost everything because they continue to test negative, even though they had symptoms, so they could not go to work, but didn't have proof that they had COVID, but they had all the symptoms.
Yeah.
So they got let go of their jobs without being able to apply for unemployment because they didn't show up for work because they were so sick.
Yes.
Some of them were in the hospital just like I was. So so I feel like COVID just highlighted the fact that our marginalized communities have not been served. They're not priority, and there's still things that have not been put in place at the federal level, at the state level, at the city level to be able to help our queer, immigrant, people of color, Native Americans that we have here. There's just a lack of interest to serve them, in my personal opinion.
I hear you. So some last couple few questions are going to be work related. So what kind of work related challenges did you have? Did you lose work? Did you receive pay cut? What was going on with you personally?
Work, thankfully, I work for the state. I have really good health insurance that has a great coverage. They were able to cover 100% all mental health um, appointments and things like that. And so that was very helpful. They were able to approve telehealth when I heard other private insurance were not able to. So that was great. I was able to get flexibility from my administration to be able to, adjust the hours that I worked and to do work in, when other people were sleeping and I was awake. So that flexibility made a huge difference for me. So I didn't have to lose income that way. I did have a part-time job that I lost because of the pandemic. So that second income I had to so I had to do without.
Yeah, I understand that. So this is a sensitive topic. Obviously, if you do not want to answer that question, you don't have to. But as a person that is not from here or that has family from not the United States, do you guys have any concerns about documentation status at any times during COVID-19?
Oh yeah, definitely. That was one of my main concerns because the the community that is here without documents, they are working and they have those jobs that are essential. They were deemed essential. So, but a lot of them, like I said, they were sick or they were if they were laid off because they had COVID, they could not apply for unemployment because they don't have documents. So that was a huge hit for the undocumented community, which is our essential workers,
Yep.
the people who are making our food, people who are, working at the packing plants. There were so many that were being abused at the different packing plants
Yep.
that were being made to go in, even if they were sick. And at the same time, then they were exposing others, in those plants around the state.
Yeah.
Um, and I had like that's how my stepfather got sick. He was working for this fast food restaurant, and they were not mandating for them to wear masks. They were not taking care of anything, so he ended up with COVID, and so did my mother. So there were a lot of the impact in the undocumented community was huge, not just here in Iowa, but everywhere, because they also do not qualify for state or federal assistance. So they could not get unemployment, they could not get housing help, they did not qualify for anything. So it's been huge. There were people that even were thinking about going back, but then going back, they were afraid because things might be worse in their home countries.
Of course. Yeah.
And so it impacted the undocumented community in a very, very huge way.
I agree. So how did your work change? Like how did you do this shift towards to accommodate the pandemic and all of the
So
things that it put in the way?
So during the pandemic, I started focusing on one, providing information in Spanish for the community.
Yes.
Started translating with some community partners, the governor's press conferences and the proclamations, and then so someone would translate them, and then I read them and make a video every day that there was a new one in Spanish, and then I would post it all over Facebook. So last year, my work became focused on educating the community about their resources, about provide them information in their languages because it wasn't happening. I was able to reach out to PBS to see about if they could translate the governor's press conferences because um, they were live on their feeds, and they were able to. So I connected them to two interpreters who started interpreting the press conferences live. So that was a huge win for the Latino community because then that allowed me time to focus on something else.
Exactly.
And then once when we saw that there was really no one assisting or focusing on helping the Latino community in the state, we were able to bring on the Spanish helpline as part of my job
Yes.
because I started as a volunteer, and then I was able to bring it in to be able to do it during my work week. And so a lot of my efforts were around education and providing resources. And I actually had 14 AmeriCorps staff in the summer that helped me answer the helpline and provide information. And they stayed busy the whole time because people were calling. They wanted help with filling out paperwork, reading mail that they got, applying for unemployment, or for the undocumented community, they wanted to know where they could go get food and things like that. So we partner a lot with different churches around the state, groups of people that just wanted to help. I got phone calls from many, many people telling me, if you need something, my church is here, we can help.
That's
So I was able to create a lot of new partnerships because people wanted to help.
that's great. That's I feel like that's the good things that came out of COVID. All like trying to work together, trying to find out solutions to help people that maybe can't help themselves because of that language barrier or that immigration status barrier.
Yes.
So, these are the last questions. So, how, if at all, have the current social movements in conjunction with COVID-19 impacted your daily life? Like, I guess the anti-vaxxers or the anti-masks. How did it affect you?
Personally, I don't know if I got sick because someone refused to wear their mask, because someone was not socially distancing. Obviously, something like that had to happen for my daughter to get it, and then for I to get it. So all of us who got it during the pandemic, during that time that we were still, being isolated. There was someone at one point that did not follow what was supposed to be followed. So you had a huge impact, like I said before, not just mental health and financial and physical, but now a year later, still, having all these issues, with income and having to take time off work and all of that stuff. Um, but I think that, like you said, a lot of good things have come out of it, but there's still a lot to be done because we're still not out of there. We can still get the virus. I actually know one of my really close friends is a teacher, and she got vaccinated, but then she got COVID about 2 weeks after she was vaccinated.
It's great.
So from one of her students. So it's still a very real threat, and
We're
that's
not,
how I
yeah,
see it.
we're not out of the woods yet for sure. So, did participating in the protests back in 2020, was your decision based? Did your COVID decision base that as participating?
So I participated. So I put together a unity march when against police brutality here in Des Moines. Because it was around Pride Month. So this was right before I got sick, about a month before. Um, we wanted to, me and and other community members wanted to um, to support the BLM movement and to speak up against police brutality. So we put together the Unity March, like I said, which had individuals of color from from all over the metro, people with refugee statuses, people who were born here, people from Puerto Rico, a lot of Afro Latinos, because we have a lot of Afro Latinos in the Latino community who when people see them, they assume that they're African American. And the same with some of our immigrants with refugee status. People assume them to be African Americans, and they are treated as if they are, which is not all the time that well. So we put together this march and a rally, and we talked about that. And masks were mandatory. We had so many organizations that came together and provided just different resources, masks. They provided different things for people for self-care at the march, and it was a great event. And I feel like we did a really good job, or the communities did a really good job by showing up to support
Yes.
the BLM movement, to support, and not just the BLM movement, but to speak up against police brutality, not just for the Black community, but also for the Black queer community, for the transgender individuals that, which continues to happen still.
Yes, of course. So we have concluded all the questions. Is there anything else you would like to share with me about your experience with COVID-19 that I haven't asked you about? Any last words of
No,
wisdom?
nothing that I can think of right now.
Okay, well, this was a great conversation. All the things that you said were it's pretty traumatic, I'm sure. But I want to thank you again for being a part of this project. I think it's really important that we give the opportunity for people around the world to see what the Latino experience really is about. And I want to thank you again for participating.
Thank you for inviting me.
Thank you so much. You have a great day, Sonia.
Thank you, you too.
Bye.
Bye.